I'm Dr. Phani Madhuri. I'm a senior consultant obstetrics, gynecology, fertility medicine and laparoscopic surgery at Kiran Infertility Centre, Koramangala, Apollo Cradle Hospital, Jayanaka, Bengaluru. Stress and infertility is a constant topic of debate. We really don't know which one has come first, whether infertility has caused stress or stress has caused infertility. But there are many studies which have shown that cognitive behavioral therapy of these patients who are going through chronic stress because of infertility, where they have had stress relieving methods to help them, have drastically improved the pregnancy rates in these patients. So definitely stress reduction in these patients is going to benefit them to conceive either naturally or through ART. Now, we have seen this constantly in a lot of patients that even today in our society, infertility is a social taboo. People don't want to, first of all, accept the condition and openly discuss this with their friends and family. They always fear that they may be judged. They are constantly suffering from low self-esteem. They are having feelings of shame, guilt and negativity because of this condition. And sometimes even the partners don't want to openly talk about this among themselves. So we always encourage patients to actually come out of this guilt factor and accept it as a medical disorder and take control of what is happening, take charge of what is happening. So various methods like good healthy diet, portion control meal with mix of lot of fruits and vegetables, nuts, seeds, whole foods at home prepared by yourself is going to enhance your nutrition. At the same time, your stress levels will come down because you're eating right food. Then comes your exercise. You can opt for any exercise that you like, but relaxation exercises like moderate intensity walking or some dance classes, music classes or yoga, meditation, these have shown to be drastically helpful for these patients who are going through chronic stress and infertility and irregular periods. And good sleep is extremely important for these patients. We always encourage them to wind off their day early. We see that the stress levels are high for patients who are working in odd hours. So try to move to a job which is a 9-to-5 job. Try to keep your evenings calm and stress-free and wind off your day early so that you get quality time with your partner towards the evening, and try to encourage in bonding activities like outdoor exercises, or you can go traveling, you can meet friends, socializing. These things are very important to kind of de-stress yourself. And hobby classes are extremely important for these patients, diverting their mind instead of thinking about the treatments and what will happen tomorrow, whether they will ever become pregnant or not. These are the constant thoughts that they're pulled down every day by. So we encourage them to distract themselves, move to positive hobby classes which will keep them engaged, at the same time boost their confidence levels. So once you rectify the body weight, you rectify their lifestyle and you rectify their sleep, we see a lot of positive changes in them tackling this condition called chronic stress because of infertility. Yes, so there is a correlation between the two conditions and both of them help each other. Like if you reduce your stress, definitively you can help in improving your outcomes through your fertility treatments. Does stress affect your hormonal condition? Yes. Now, chronic stress can result in continuous elevated levels of cortisol in your brain, which can affect your HPO axis, that is your hypothalamic pituitary ovarian axis, where there is some kind of a disruption in this whole HPO axis, which probably is responsible for disrupting your normal ovarian hormones, which are produced in such a dynamic, sensitive fashion because you have a different set of hormones for the 4 different phases of your menstrual cycle. That is your menstrual phase, your follicular phase, your ovulation phase and your luteal phase. So you have a fine balance of different hormones like estrogen, progesterone and testosterone that have an interplay in these phases of your menstrual cycle. So naturally, when you're stressed and your brain is not working effectively, the cortisol levels and the sleep abnormalities can all add to bring about changes in your hormonal conditions. Like I said, the mind is the one which is controlling most of your organs, including your reproductive system, right? And reproductive system is more so controlled by your HPO axis, that is your hypothalamic pituitary ovarian axis. So you have a brain and body connection here very strongly going on. Everything is dictated by how you're feeling in your head. So happy couples, stress-free couples, people who are, not taking up this condition too much to their heart and feeling, anxiety, depression, sleeplessness and feeling helpless because of this condition, will always, people who are able to approach this condition with a more positive approach are able to tackle this in a better fashion, is what we see daily in our clinical practice also. So I encourage patients to always come out of the fear, talk openly about the condition, accept it. There is nothing wrong, there is nothing shameful about fertility issues. Lot of couples are going through it. Only problem is people are not talking enough about it. That is the reason you feel lonely in this journey. You probably feel you're the only one who's taking the whole burden of this disease, and you feel that you're not competent enough. So what I'd like to say is, actually this is a community disease. There is a lot of social problem because of this condition, and helping each other through communication, through support groups, and if not, professional help, counseling, etc. also can be greatly helpful in treating this condition called infertility. So how do we manage stress because of this condition called infertility? I think simple tips like lifestyle changes, managing your work-life balance, having stipulated work hours, taking time off for yourself, self-care, self-love, communication, open communication, meeting your friends, family, having distracting positive hobbies, all these are very, very helpful in tackling this condition. And of course, you can get into practices like yoga, meditation, which will also enhance the blood flow to your internal organs, is going to be extremely helpful. And also try to correct your sleep. So once you correct your sleep, most of your body hormones try to function in the normal way, because endocrine system falls into place and your hormonal functions restore back the way they are supposed to be. So we have seen a lot of positive changes by doing these simple lifestyle hacks. And if not, you can always seek out therapy. You can meet professionals, you can meet psychologists, psychiatrists who might understand this condition in detail, and if needed, they can help you out with counseling and therapeutic options, which are fantastic in treating this condition and improving your ART outcomes.